This skill is providing perineal care for a female. Allie will say she's washed her hands, knock on the door, provide privacy, and explain procedure.
Hey, Ms. Smith, my name is Allie. I'm your CNA, and today we're going to provide period care.
She will now go to the linen closet and get her materials. She'll put a barrier on the overbed table. She gets 4 washcloths and 2 towels. At this time, she'll go to the other table, get her basin, her soap, her gloves, and her blue barrier. She'll bring those back to the table. At this time, she'll go to the clean sink and get her water. Her water has to be tepid or lukewarm. The candidate must fill the water before she allows the client to fill the water. She comes back to the bedside and she allows the client to fill the water. She now will go put her basin on the overbed table, say she's washed her hands, and apply her gloves. To avoid overexposure, we have the curtain pulled, and we can pull the sheet down to the knees and the gown up to the waist. At this time, she will place the blue barrier on the bed to protect the bed. While Allie is doing that, I'm going to raise the side rail. This is not part of the skill, but sometimes the mannequin will fall off if we don't do this, so I'm going to raise it for her now. Just remember, that's not a required part of the skill. She will now take her washcloths. She'll leave it folded and dip it into the water, and she will put soap on 3 corners of the washcloth. This way she'll be cleaning the area with a clean area of the cloth each time. Okay, now she'll take the cloth and she will start at the clean area with the corner of the washcloth, and she'll wipe all the way down to the rectum on that side. She'll turn a corner and she'll go to the other side and clean, and then she will take a third part of the washcloth, go down the middle and wash to the rectum. Now she will rinse the same way. Again, there's more than one way to do this, but this is just an easy way to make sure that you do not wipe over an area more than one time. She's cleaned on both sides down to the rectum. She cleans down the middle to the rectum. Now she will take a towel and she'll take the 4 corners of the towel and she'll dry the very same way. On the outside toward the rectum, outside toward the rectum, and down the middle toward the rectum. She turns her cloth each time. At this time, she would turn the mannequin on its side. And now she will do the very same thing. She'll take a washcloth and leave the corners folded. She'll apply soap to 3 corners of the washcloth. This time she will start from the rectum and go up on each side and then in the middle last. She cleans up, she turns the cloth, she cleans up on the other side, she turns and she starts at the rectum and goes up the middle. Now she will rinse the very same way. It's very important that you clean to the rectum when they're lying on their back, and you clean up from the rectum when they're on their side. She turns the cloth, and then she starts and she rinses the middle. Now she would take her towel and she would dry with a 3 corners of the towel, just like she did the front. She turns there, she turns and dries, and then she turns and dries up the middle. At this time, she can remove the barrier, put the mannequin back on its back, and cover the mannequin up. She can now roll her table over into the dirty area. Remember, again, for stake testing, it's one room, so we don't have to worry about taking the table over there. She will dispose of the wet linen into the linen hamper. She'll dispose of the blue pad into the trash. She'll put the soap on the counter. She will put the rinse water into the bedside commode. She will rinse the basin and put the rinse water into the bedside commode. And she will dry all surfaces. She will dispose of the towel that's on the overbed table into the linen hamper. Remove her gloves the proper way. Say she's washed her hands.
Wash my hands.
She will go back to the client's bedside. She will give the client the call button. She will push the curtain back, say she's washed her hands and completed her skill.
Wash my hands and clear my skill.